Hello and welcome. You're listening to the Health Insurance 411. My name is Steve Stump, and today I want to talk about a really exciting event that happens in parenthood. Hooray! Your young adult child finally got a job, and in that job, they can get health insurance benefits. They're off the payroll, right? Well, hey, it may not make sense for that young adult child of yours to enroll in that employer's health insurance benefits. And that's what I want to talk about today. Did you know that they can stay on your health insurance plan until they're 26, regardless of whether it's an employer plan or it's a plan you purchased for the family? They can stay on until their age 26. And here's some reasons why it may make sense to keep them on your plan. Be sure to give it a like and a subscribe so that you can stay tuned for future episodes. But let's talk about reason number one. Now, obviously, reason number one is it's a good enough or a good plan matches what they have with the family or better plan. So some things to think about so that you know whether your young adult child is getting an equivalent plan or a better plan is first, is it a PPO or an HMO plan? What do they have access to currently with a family's plan? Obviously, you want to understand what is the deductible that your young adult child will have to pay into before they start to receive some benefits for their care. Beyond that, what is the co-insurance rate that they're going to be paying? And then what is that out-of-pocket maximum limit that they have to reach before they actually start to get 100% of the coverage that they're entitled to underneath the plan? If all of those are higher dollar figures, then it may make sense to keep them on the family plan. Don't forget co-pays as well. How much will they pay every time they go see a doctor or have an ER visit or have an urgent care visit? All right, number two. So number two is you need to understand the tax benefits. Okay, so you probably know that when you pay for your premiums and you're on an employer's plan, those premiums are taken out of your paycheck in a pre-tax way. They're reducing your taxable income and therefore benefiting you at the end of the year. Now, if you're like most parents, as we all grow older, as you know, we earn more and more and more. Earning potential tends to increase. And so it's likely that a young adult child is not earning as much as you are and isn't in the same tax bracket as you are. You are probably in a higher tax bracket. So the benefit for you to take those tax deductions in your paycheck is actually more beneficial to the overall family's tax situation. Now, you need to consult your CPA for what the impacts are going to be, but this is something you should consider. Now, also keep in mind, your employer probably contributes to your premium, but probably doesn't contribute to your dependents. But if they do, that could be a game changer because yeah, your young adult child is probably going to receive a contribution from their employer, but if it matches or if it doesn't exceed the contribution from your employer, it could be a net wash. All right, number three. The number three reason why you should keep your young adult child on the plan. Now, this one's an interesting one. Okay, so you know when you purchased your plan or enrolled in your plan, you selected a deductible and an out-of-pocket maximum for the family. And depending on what time of the year your young adult child gets that job offer and is looking at the benefit package, it may make sense to keep them on your plan, especially if you know they're going to have care coming up within the year and you've already paid in to that deductible and out-of-pocket max, or you've got other family members that you know are going to require some care later on in the year, maybe a planned surgery, and the care that young adult child gets and the amount that you pay in for the out-of-pocket maximums for the family and the deductible could benefit you long term. So think about how much have you spent in healthcare to reach some of those deductible limits and out-of-pocket limits across the family. And if it makes more sense to keep your young adult child on the plan so that you can receive some of those benefits of co-insurance or 100% coverage, then it may make most sense to have your young adult child wait until next enrollment period. Well, my name is Steve Stump, and one of the things I love to do is help people understand how the healthcare industry is rigged against them and how they can rig it in their favor. Just check out the video where you can learn how to rig the game in your favor at www.insuremesteve.us/rigged. Be sure to give this video a like, a share, and stay tuned for next video coming up tomorrow and throughout the week, as each day I want to provide value to you and help you navigate the health insurance world. This has been Health Insurance 411, and my name is Steve Stump. Thank you for listening.